A very good evening, my dear students. Good evening to one and all. I am Dr. Anaya Kulkarni Kale, here, your faculty for Pedodontics. And today I'm here to discuss with you the most important topics of Pedodontics from the exam point of view. A few questions that you can say are very important, that will give you an insight to almost the entire chapter, and the topics that you should be going through very precisely, very carefully. The chapters, the units that contain the most weightage when it comes to the INICET and the NEET examination. So before we start with the questions, let us just go through this lovely saying by Abraham Lincoln, that was, the best way to predict your future is to create it. The best way to predict your future is to fabricate it on your own, to be prepared about it, to know what to expect and how you are going to perform. So we, the MDS gurus from DBMCI, are here to help your way towards your predicted future, towards your dreams. So now that we are here to discuss about the important questions of pedodontics, I have broadly divided the subject into 5 major topics that contain the most weightage in the question papers. So these are child psychology, the behavior management, which includes the pharmacological as well as the non-pharmacological behavior management. We have pediatric endodontics, there is development of occlusion, and there is traumatic dental injuries. So these topics contain the most weightage when it comes to the exams. Okay. Yeah, so let us discuss the questions that I have listed down as the most important questions, the 12 most important questions for you all. So the first question is, raising one's voice and speaking firmly to a child. So we, in the non-pharmacological behavior management, we had read about this technique called as the voice control, and it has the effect of, what effect does voice control have on a child? So the options that have been given to you are: option A, frightening the child into submission, that means scaring the child with your voice so that the child submits, or so that the child lets you do whatever you want to do. The option B says effectively making the limits of unacceptable behavior known to the child. So that means that you are telling the child that until now I have listened to you, I have empathized, I have been, submitting to your demands, but now this is the limit and now I am going to, overpower, or this is the limit. You cannot be making us listen to you more than this. So you are doing what? You are making limits of the unacceptable behavior. That means you cannot go beyond this. Now you are supposed to follow our instructions. So is this that? Or option C, unnecessarily raising the child's anxiety. So the child is already anxious, and by shouting at the child, or not exactly shouting, but like by raising the volume of your voice, you are raising the child's anxiety, which definitely you do not want to do. You are already you are already unable to perform your best in the dental treatment because of the anxiety of the child, so you don't want to raise the anxiety of the child. The D option says that focusing the child's attention on the dentist's anxiety. That means by raising your voice, you are making the child feel that, oh my god, this dentist also looks scared. So the option here, the correct answer here is option B. That is, effectively making the limits of unacceptable behavior known to the child. You possibly should not be frightening the child into submission. That will be more like bullying the child. Or you shouldn't be increasing the anxiety of the child. Neither should you be giving the child an idea that you are scared of him being anxious. So that completes the first question. So now we know voice control is a way to set a limit to the ill behavior of the child. Okay, the question 2 says that to gain the cooperation of a child with a different cultural background. When I say cultural background, it means that probably the child might have a different language altogether, might be talking in a different language altogether. Like, for example, I treat patients here in Bhopal, Madhya Pradesh, and there are patients who come for various reasons, as probably as tourists, and they might be coming from Kerala, and the child might be talking only in Malayalam, and it is difficult for me to counsel the child in his language. So what do I do? What should the dentist do? So the option A is attempt to speak in the child's language. My god, that's going to be really funny. Don't do that. Provide treatment under general anesthesia. So just because you cannot talk in the child's language, you cannot counsel the patient in his own language, this is no reason to take the patient in or treat the patient in general anesthesia. So that again is a wrong option. Option C says sedate the child and proceed normally with the treatment. So sedation altogether is done when all sorts of behavior management techniques fail. When all the non-pharmacological behavior management techniques fail, only then you are supposed to do sedation. You are supposed to use sedation as a technique. So all of these three options are a complete no, whereas option D that says demonstrate the procedure before performing it, that is the right answer. So we had read when we read about the non-pharmacological behavior technique, we read about a technique called as tell, show, do. Okay, so there was a tell, show, do technique, and this technique was given by Edelston. In this technique, what is to be done? You first tell the child what you are supposed to do using terms that are understood by the child, also known as euphemisms, and then you show the child what you are going to do with the help of models. Like, for example, you can take a cast and then you can demonstrate using some toy instruments on that cast, or you can show a video, or you can give a comics for them to read that elaborates or illustrates the treatment procedure that you are going to proceed with. So that's the show. And do, that means once the child is clear what is going to be done or what he should expect, that after that you proceed with doing the treatment. So that's called as the tell, show, do technique. So if the child is not able to understand your language, you can make use of models or videos or various types of jigsaw puzzles. There are various puzzles and there are comics that elaborate what treatment is supposed to be done, and you can use these things to show what is to be done, and then you can gain the cooperation and the confidence of the child because he knows what is going to be done when. Okay, so when the child is from a different cultural background, you can adapt the technique called as tell, show, do in order to gain the child's cooperation. Clear? Question 3. A 4-year-old patient will respond most favorably if the dentist shows. So how do you expect a 4-year-old child to cooperate with you? So whether you will show empathy and respect, whether you will show domination or genuineness, whether you will show reasoning and concreteness, or whether you will show pessimism and permissiveness and compromise. So the answer here is A, that is empathy and respect. So let us understand what do the other options mean. So option B is domination and genuineness. So domination means you are trying to dominate the child. That means when he says, I am very scared of the noise of the aerator, you say that there is no need to be scared of the noise of the aerator. Nothing is going to happen. See, this is only going to, you'll only have water in your mouth and then you'll have to spit. So there you are what you are doing. There is genuineness. What you are telling is correct. You are being genuine, but you are dominating the child. You are rejecting his process of thoughts and you are dominating the child and trying to tell him logic. But the child is only 4 years old and he is not going to follow your logic. So option B becomes incorrect. Option C is reasoning and concreteness. So reasoning, as I already told you, application of logic. So you cannot be reasoning with a 4-year-old child. You cannot be telling that if you do not get this filling done, the microorganisms are going to reach your pulp, and then you're going to have pain, and then you'll have to get root canal done. No, such reasoning the child will not be able to follow. So reasoning and concreteness, that means the facts. You cannot explain the facts to a 4-year-old child. So again, option C becomes incorrect. Option D says permissiveness and compromise. So what is the meaning of permissiveness? Permissiveness means to allow or to permit the behavior of the child beyond your own limit. Like, if the child is saying, if the child has kept his hand over his own mouth, or probably he's saying, I do not want anything to be done, he's running around, you're just permitting him beyond the limits. You're just letting him behave as he is behaving. That is called as permissiveness. If the child says, do not use the aerator, just use that instrument over there, it will not hurt, and then you listen to the child because he is not letting you use the aerator, you try to scrape the caries with a spoon excavator. So what you are doing, you are permitting or you are giving into the patient's demands. You are compromising in your treatment. So permissiveness and compromise again becomes an incorrect option. So the correct answer is empathy and respect. Empathy means to relate to a person's problems. That means you listen to the problems of the child. Do not reject the child's problems altogether. Like if he's telling, when I eat I have pain, when I have sweet food, and like, oh, it's okay, I know when do you have pain. So don't do that. Listen to the patient carefully, show some empathy, show some respect that he's trying to convey something, and that is how you will be able to gain the confidence of the child. So have you understood the meaning of all the terms, all the 8 terms that have been told here? So the correct answer here is A, empathy and respect. Clear? Now the fourth question is, a broad understanding of development of human behavior requires a knowledge of the basic concepts of. So in order to understand the development of human behavior, you need the knowledge of basic concepts of maturation and learning, masculinity and femininity, dependence and independence, or generalization and facilitation. Okay, so the answer here is maturation and learning. That means you need to know what, according to the age of the child, what is the level of the child's maturation and the child's cognition ability. How much will the child understand? Like, you cannot directly relate the level of understanding to the age of the child. A child at different ages will have different levels of understanding, different levels of cognition. So what you need to know is, you need to know the level of maturation of a particular person. So you need to know that even if this child is 6 years old, he is able to follow all your instructions, he is able to follow what you are telling, the procedure that you are explaining. So he has a good level of maturation and he is able to learn what you are telling. So this is what you must know in order to understand the development of human behavior. We are not talking here about the development of a human physically. A child might be 15 years old but might not cooperate and might not follow with what you are saying. That means the development of the behavior is different. A 6-year-old might cooperate better as compared to a 15-year-old. So what you need to know is not masculinity or femininity, not dependence or independence on, like on what factors does the happiness depend, on what factors does the unhappiness depend. You do not need to know that. You do not need to know, you do not need to follow generalization. Like, when you say generalization, that means oh, this is a 10-year-old child, that means he is sure that he will cooperate. He is a big child, he is not 2-year-old, he is not 3-year-old. 10-year-old is pretty adult, so this person is going to cooperate. So you cannot generalize it. Okay, a 10-year-old might might cooperate, the other 10-year-old might not cooperate. So you cannot generalize these factors, and hence generalization and facilitation again becomes an incorrect option, and the correct option is maturation and learning. The maturation of a particular person's mental status, and how much the person can follow, what is the level of cognition or learning of that particular person. Okay. The next question, that is the fifth question, is so very carefully just read with me. A cooperative 5-year-old child has a carious lesion in the primary mandibular second molar. So there is a primary mandibular second, okay, the molar, so there is a primary mandibular second molar over here. Okay. So you know why the roots of the mandibular molars are flared like this, primary molars are flared like these, because they have to occupy, they have to provide a space for the permanent tooth bud over here. Hence, the shape of the roots of the, or the shape of the flare of the roots of primary molars is like this. Correct. So the question says, a cooperative 5-year-old child has a carious lesion in the primary second mandibular molar. There is no tooth mobility, but the practitioner notes a small draining sinus tract adjacent to the tooth. Okay, so when you look at the gums, when the clinician looks at the gums of that particular tooth, there is a small draining sinus present over there. Draining sinus, that means there is a small intraoral swelling. Okay, on the gums with pus oozing out of it. Okay, so this is also called as a draining sinus. Clear? So there is no mobility in the tooth, but the practitioner notes a small draining sinus tract adjacent to the tooth on the gums. So when he says that adjacent to the tooth, that means it's on the gums. Which of the following is the treatment of choice? So what are you going to do with such a tooth? There is no mobility, but there is pus emanating from the gums just adjacent to the tooth. So whether you will go for extraction or pulpectomy or indirect pulp therapy or calcium hydroxide pulpotomy. So let us just rule out one by one all the options that are incorrect. So let us first come to the option C, that is indirect pulp therapy. So you cannot do an indirect pulp therapy because when there is a carious lesion and there is pus emanating or pus oozing out, or there's a draining sinus just adjacent to the tooth, that means the radicular pulp and the coronal pulp both are infected. So the radicular and the coronal pulp, both are infected. That is why there is pus that is present, that is there is a draining sinus present adjacent to the tooth. So when the radicular and the coronal pulp both are infected, that means indirect pulp therapy is not possible. When do you do an indirect pulp therapy? You do an indirect pulp therapy when there is a healthy coronal and radicular pulp. Okay, when both the coronal and radicular pulp are both healthy, that time you can do an indirect pulp therapy where you protect the healthy pulp. Okay, so now you know that there is a draining sinus, there is no possibility that the pulp is healthy. So indirect pulp therapy is a wrong answer. Correct. Now, calcium hydroxide pulpotomy. So as I told you earlier that there is a draining sinus, which means both the coronal and the radicular pulp are both infected, and you do pulpotomy only when you have a healthy radicular pulp. When there is a radicular pulp that's healthy, non-infected, and only then you can do a pulpotomy. So pulpotomy also becomes a wrong answer or an incorrect answer because clearly the radicular pulp is infected and pulpotomy wants a good healthy vital radicular pulp. Clear? Then let us come to these two options, whether you will go for an extraction or whether you will go for a pulpotomy. So the first thing you see is that the child is 5 years old. So when you see the child is 5 years old, that means the tooth is not even, halfway in the process of exfoliation. There is a lot of time before the tooth naturally exfoliates, which means what? Which means that the roots of the tooth must be okay. There might have been no physiologic resorption due to the pressure of the successor tooth, because there is a lot of time before the tooth exfoliates. So there must be no physiologic resorption. The tooth must be healthy and complete. Secondly, there is no tooth mobility. There is no tooth mobility. That means, one, that the root is complete, and two, that there is sound support. That means the periodontal ligament support of the tooth is extremely sound. That means there is no mobility. So when the tooth is far away from the period of exfoliation and the supporting structures are in excellent health, you should not go for an extraction. But what you should do, you should immediately do the axis opening of that particular tooth, clean the radicular and the coronal pulp, and give an open dressing, so that the abscess drains out, of the tooth. So what you're supposed to do, you're supposed to do a pulpectomy. Is it clear? So when you see such a question, when there is a clinical based question, there are a few things that you must take notice: the age of the patient, the status of the tooth, and what is being asked. So just have a look at this question: the age of the patient, that there is no mobility but there is a draining sinus tract. So draining sinus tract will give you an idea that the radicular and the coronal pulp are infected. No mobility will give you an idea that the PDL is okay, and 5-year-old will give you an idea that the tooth has not suffered, or there has been no physiologic resorption of the tooth root. Clear? So let us come to the sixth question. So the sixth question is: the success of pulpotomy of a primary molar depends primarily upon. So we just went through the same concept in the earlier question. So it depends upon a vital root pulp. Does not depend upon the patient's age. It does not depend upon the amount of resorption. It does not depend upon the root morphology. The only thing that pulpotomy is interested in is a vital and healthy root pulp. Wherever there is a vital and healthy root pulp and the coronal pulp is a little inflamed, you can straight away, without thinking, go for a pulpotomy procedure. Clear? Then comes the seventh question, which is: from the list of the microorganisms, which is primarily responsible for the initiation of the dental caries? So we have here in the options 4 different microorganisms. We have mutant streptococci, there is bifidobacteria, there is lactobacilli, and there is P. gingivalis. So when I talk about all of these 4 bacteria, let me tell you that mutant streptococci, bifidobacteria, and lactobacilli, all of these 3 are responsible for causing dental caries. They are responsible for degrading the sugars and starches and creating dental caries. Whereas P. gingivalis is the bacteria that results in plaque formation because it facilitates in co-aggregation. You would have read about co-aggregation in perio, and it leads to biofilm formation. So when you talk about P. gingivalis, it means it is something related to plaque formation. So this is out of the race only. Okay, so P. gingivalis does not result in initiation of dental caries. Now we know. So now the other three bacteria, lactobacilli and bifidobacteria, are the two bacteria that result in dental caries at a very later stage. They result in dental caries when there is a drop in the pH of the plaque. So when there is an evident or extreme drop in pH of saliva or plaque, at that time the bifidobacteria or the lactobacilli comes into action, and it it promotes the deepening of the dental caries or formation of dental caries. So the answer here is mutant streptococci. So whenever you see the word initiation of dental caries, that means you have to blindly go for mutant streptococci. The first microorganism to start dental caries is mutant streptococci without any doubt. Okay, so question number 8 says, which of the following is the least likely to cause rampant caries in the geriatric patients? So the word geriatric stands for old age patients. Okay, so when we see the old age patients, which is the least likely to cause rampant caries? So poor oral hygiene can be a reason in the old age patients. They might not be able to maintain the oral hygiene so well, so that can be one reason. Decreased salivary flow, definitely with the increasing age there is decrease in the salivary flow. The side effects of medication, definitely one reason, because there's a lot of medications that has to be taken by an old age patients, and side effects of a lot of medications leads to xerostomia, which leads to rampant caries. So again, but change in the oral microflora is definitely the least likely to cause rampant caries, because change in microflora occurs during birth and then during the mixed dentition. But in the geriatric patients in the old age, there is very less chances of the microflora to alter. Hence, this becomes the least likely reason for the cause of rampant caries. Question number 9. So, success of pulpectomy in a primary tooth will depend upon which of these factor combinations? So, they've given 4 factors. Pre-operative radiographic evaluation. So again, it is very important to evaluate the radiograph whether the particular tooth is indicated for a pulpectomy also or not. If there is a lot of bone loss, there is a lot of abscess, or there is a furcation involvement, that means that the pulpectomy is not going, it will have a very poor prognosis, and the tooth is not indicated for pulpectomy. So the pre-operative radiographic evaluation becomes a factor on which the success of the pulpectomy depends. The second is proper mechanical debridement with correct instrumentation. Okay, so correct instrumentation is okay, but proper mechanical debridement is not possible in a primary tooth. That is because there are a lot of accessory canals present in a primary tooth that are unreachable with the help of your files or the hand or the rotary instruments. So a complete debridement of a primary tooth is impossible. You can just navigate through and debride the main canal, but the accessory and the lateral canals are difficult to be negotiated. So proper mechanical debridement with correct instrumentation in case of a primary tooth is not possible. Proper post instrumentation restoration. So once you've done the biomechanical preparation, the restoration that you do after that is very, very important. How much ever properly, you need to seal it very well so that there is no place for the microorganisms to seep in. And then amount of external root resorption. Obviously, if there is a lot of external root resorption, that is going to result in failure of pulpectomy very, very soon. So the success of pulpectomy in a primary tooth will depend upon the combination of A, C and D, that is option B. So the answer here is option B. I hope you followed. Question number 10 is a contusion injury results from a crush, a cut injury, blunt trauma, or a penetrating injury. So the answer here is blunt trauma. So contusion means whenever like you're walking very nicely, looking into air, and then you don't have you are not careful where you're walking, and you suddenly hit your ankle on a table. So you'll have that bluish greenish nice little wound over there, right? It'll not be a trauma, it will not be a penetrating injury, it is not going to be a cut injury, no laceration, nothing, but it is going to be a hit because of a blunt trauma, and that is called as the contusion injury. Okay, a cut is like a laceration or a tear, a penetrating injury is like a stab, that's the penetrating injury. But whenever you see the word contusion, you just imagine your ankle hitting a table very hardly, you'll just feel the answer. Correct. So the question number 11 is, in a primary tooth, intrusion is common because, so intrusion injuries, that means what is intrusion? Intrusion means a tooth going inside the socket. Okay, that's intrusion. So it is common because the alveolar bone is pliable. Yes, the alveolar bone is soft. The vertical overlap of the teeth, so there is an increased overjet in case of primary teeth. There is a greater vertical overlap. Overjet and overbite is increased in primary teeth. So there's a greater overlap, a vertical overlap of the teeth in case of primary teeth. Lip protection to the maxillary anteriors is very delicate. Just imagine the lip of a small child. It is very delicate. How much cushioning will it provide? So the answer here becomes, in a primary tooth, the intrusion injuries are common because of all of the above. So all of these three factors contribute to the intrusion injuries in case of primary incisors. X articulation of the teeth means. So what is the term? What is the meaning of the term X articulation? So when we say articulation, articulate means to seat in some place. So this is articulate, and X articulation means to pull out or to come out. That means a complete removal or avulsion. Okay, so avulsion means complete removal. So that is X articulation. So X articulation of teeth means avulsion. Okay. The 12th question that I have picked for you is, if a flush terminal plane is present in the deciduous dentition, so immediately as soon as you see flush terminal plane, so you make this. Okay, so flush terminal plane, that means both the primary second molars are sitting on each other like this, exactly end to end. Okay, so flush terminal plane present in the deciduous dentition, then the molars will erupt in which relation? So the answer, you like if you would have attended my lecture, we read that a flush terminal plane in the primary dentition might result in either a class 1 occlusion or it might result in an end-to-end relation. Clear? So the answer here is an end-to-end relation. Why? Because here it is written initially in class 1 occlusion. So when we just look here, okay, so we have a flush terminal plane like this. These are the primary second molars, and here when the when the permanent first molars erupt, the first thing they will do is erupt in an end-to-end occlusion, and if eventually there is a mesial migration of this entire segment, only then this tooth will migrate mesially, and then it will result in a class 1 occlusion. So what occlusion in what occlusion does a particular primary dentition develop depends upon how much mesially, whether there's a mesial migration of the segment or not. But first thing a flush terminal plane will develop into is an end-to-end occlusion. If there is a mesial migration, only then it is going to develop in a class 1 occlusion. Otherwise, it is going to stay in an end-to-end occlusion. Is it clear? So I've tried to explain you very quickly all of these 12 questions with a little explanation, a little diagrams and everything. If you have any doubts, any at all, you know where to reach me. Just feel free to ask whatever doubts you have. Go through the chapters that I just told you. There's a bulk of questions that is being asked in those chapters. And do not worry, we are all here to help you with your preparation. All the very best.